Did you know that while you sit and listen to this video, somewhere in the United States, another senior will suffer a stroke? That is one life, changed every 40 seconds. For adults over 65, the risk climbs sharply. Yet most do not realize that the very pills they take with trust each morning may be quietly stacking the odds against their brain. Picture Harold, a 72-year-old grandfather in Ohio. He followed the same routine for years. A glass of water, a pill for blood pressure, another for joint pain, and one for sleep. He thought he was protecting his health. But within 30 minutes, he struggled to hold his coffee. His words slurred, and his vision blurred. His wife thought it was age catching up. But the truth was far more alarming. The trigger was not age or diet. It was the very medications he had trusted for comfort and relief. As a doctor who has guided seniors for over 3 decades, I must tell you this clearly. Medications are powerful tools, but when used without awareness, they can quietly increase your risk of a devastating stroke. This message is not meant to scare you into avoiding treatment. Instead, it is to open your eyes to the hidden dangers inside 9 common categories of medications that millions of older adults swallow every day. In this video, we will uncover how these drugs affect your brain, your blood vessels, and your heart. By the end, you will know which pills deserve a closer conversation with your doctor and what safer options may protect your independence and memory. Before we begin, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. And if you or someone you care about takes daily medication, type 1 in the comments. If you want to learn safer alternatives, type 0. Now, let us begin the journey through 9 medications that may be silently increasing your stroke risk. Part 1. Why common medications can quietly raise stroke risk. Most seniors believe that medications are purely protective. Little shields against pain, high blood pressure, or sleepless nights. But here is the hidden truth. Every pill you swallow changes the chemistry of your body in ways both good and bad. For seniors over 65, these changes are magnified because the body processes drugs more slowly. Blood vessels are less flexible, and the heart works harder than it once did. What once seemed like a harmless prescription in middle age may now quietly increase your chances of a stroke. Let us look at why this happens. Stroke occurs when blood flow to the brain is disrupted. It may be caused by a clot that blocks an artery or by bleeding from a fragile vessel that bursts under pressure. Medications can influence both of these pathways. Some increase clotting, others thin the blood too much, and still others raise blood pressure or weaken the vessel walls. Each mechanism can quietly set the stage for an emergency that arrives without warning. Take non-steroidal anti-inflammatory drugs to the pills so many seniors reach for when their knees ache in the morning. These drugs reduce pain but also raise blood pressure and make the blood thicker. Or consider antidepressants, especially the ones called SSRIs. They balance mood but can also make the brain more prone to bleeding. And then there are sleep aids, those tiny tablets that promise rest but actually lower blood pressure suddenly at night, slowing circulation and making clot formation more likely. Scientific research supports these concerns. Studies in journals like Stroke and the British Medical Journal have shown that certain medications can increase stroke risk in seniors by anywhere from 20% to nearly double, depending on the dose and the combination with other drugs. And the danger often grows when multiple medications are used together, something called polypharmacy. The average senior in the United States takes between 5 and 7 prescription drugs every single day. That means every morning. Millions of older adults unknowingly mix substances that can clash and amplify their risk. The warning signs are often subtle. Dizziness after a new prescription. A sudden headache. Blurred vision. Or an unexplained stumble. Too many people dismiss these as normal aging. But the reality is that they can be signals that medication side effects are quietly straining the brain and circulation. What makes this especially alarming is that many of these drugs are not exotic or rare. They are household names, found in nearly every bathroom cabinet across America. The good news is that awareness brings choice. By learning which medications carry hidden dangers, and by asking your doctor the right questions, you can often find safer alternatives or lower doses that protect your health without putting your brain at risk. Remember, it is not about stopping all medications. It is about understanding them, respecting their power, and using them wisely. Now that you know why medications can be a hidden stroke trigger, let us begin to examine them closely. We will start with one of the most common and trusted categories, the everyday pain relievers known as NSAIDs. At first they seem harmless, but what you will hear may change the way you look at those little orange bottles forever. Part 2. Pain relievers and the silent heartbreaker effect. For millions of seniors across America, joint pain, stiffness, and aching muscles are daily struggles. The easiest answer is to open the medicine cabinet and reach for familiar names like ibuprofen, naproxen, or even prescription-strength, non-steroidal anti-inflammatory drugs. These pills seem like loyal friends, reducing pain so that daily activities feel possible again. But here is the hidden danger. NSAIDs may comfort the joints, yet they quietly increase the risk of stroke by altering blood pressure, blood flow, and clotting. Why does this happen? NSAIDs work by blocking enzymes called COX, which are involved in producing substances that cause pain and inflammation. This is why they bring relief so quickly. But the same enzymes also help maintain balance in blood vessels and kidneys. When those enzymes are blocked, the body begins to retain sodium and water. Blood pressure climbs, and the blood itself becomes thicker and more prone to clotting. For a younger person with resilient arteries, this may not cause immediate harm. For seniors with stiffer vessels and slower circulation, it is a different story. High pressure plus thicker blood equals a perfect storm for stroke. Scientific evidence is clear. A large study in the British Medical Journal followed thousands of seniors and found that regular NSAID users had up to a 58% higher risk of stroke compared to those who did not take them. Another report from the American Heart Association showed that even short-term use at high doses could spike blood pressure within 2 weeks, doubling the chance of both ischemic and hemorrhagic stroke. That means the very pill that eases morning knee pain could set the stage for an emergency room visit by night. Other concerns also matter. NSAIDs can irritate the stomach lining, leading to ulcers and internal bleeding. They can reduce kidney function, something already fragile in many older adults. When combined with blood pressure or diabetes medications, and NSAIDs can make those drugs less effective, leaving seniors unprotected without realizing it. The risks are not just theoretical. In clinics across the country, doctors regularly treat older patients who thought they were managing pain responsibly, only to discover that their strokes were linked to long-term NSAID use. Practical alternatives exist and can be surprisingly effective. Acetaminophen, better known as Tylenol, is safer for the heart and brain. Though seniors must avoid overdose and limit to 3,000 milligrams per day. Topical treatments like diclofenac gels or capsaicin creams deliver pain relief directly to the joints without raising blood pressure or clot risk. Lifestyle approaches like gentle yoga, physical therapy, or water aerobics can reduce stiffness naturally. Diet can also help. Turmeric, ginger tea, and omega-3 rich foods such as salmon or flax seeds act as natural anti-inflammatories without the side effects of pills. Think of NSAIDs as a double-edged sword. They dull the pain, but sharpen the hidden risk of stroke. The key is not to panic, but to be aware. To talk openly with your doctor about how often you are taking them, and to explore safer alternatives. Relief should never come at the cost of independence or memory. And if the danger of pain relievers surprised you, wait until you hear about the next group of medications. They are not for the joints or muscles, but for the mind and emotions. Antidepressants, particularly SSRIs, may seem like lifelines during grief or anxiety, but they too carry risks that few seniors are ever warned about. Part 3. Antidepressants and the hidden bleeding risk. Growing older is not only about aching joints or stiff muscles. For many seniors, the greater burden comes from the heart and mind. Loneliness after retirement, the grief of losing a partner, or the heavy weight of anxiety can make each day feel longer and harder. Doctors often prescribe selective serotonin reuptake inhibitors, SSRIs, with names like Prozac, Zoloft, or Celexa. These medications have brought hope to millions by restoring balance to mood. But hidden beneath that sense of relief lies a risk that few talk about. SSRIs may increase the chance of bleeding in the brain, raising the risk of stroke. Why does this happen? Serotonin does more than regulate mood. It also plays a role in how platelets, the tiny cells in our blood, stick together to form clots. When SSRIs interfere with serotonin balance, platelets become less effective at clotting. This means that if a small blood vessel in the brain ruptures, the bleeding may be worse and harder to stop. For seniors whose vessels are already fragile from age or high blood pressure, this can be devastating. The danger becomes even higher when SSRIs are combined with blood thinners or daily aspirin, to something many older adults already take for heart protection. Scientific evidence supports this. A major study in the British Journal of Clinical Pharmacology found that seniors on SSRIs had up to a 50% higher risk of intracranial hemorrhage compared to those not taking them. Research in neurology showed that when SSRIs were combined with aspirin or warfarin, the bleeding risk doubled and sometimes even tripled. The alarming fact is that SSRIs are among the most prescribed medications for people over 60. That means millions are exposed to this hidden threat without being warned. The problems go beyond stroke. SSRIs may cause dizziness or balance issues, which already increase fall risk in older adults. They can lower sodium levels in the blood, a condition called hyponatremia, which mimics stroke symptoms with confusion, weakness, and headache. Many seniors end up in emergency rooms thinking they are having a stroke, when in fact, the culprit is dangerously low sodium, triggered by their antidepressant. This creates confusion, delays, and unnecessary suffering. But depression and anxiety are real and deserve treatment. The answer is not to stop all antidepressants, but to use them wisely. Newer medications like SNRIs, such as duloxetine, may have different side effect profiles, though they still require caution. Combining lower doses of medication with therapy, counseling, and lifestyle changes like daily walking, social engagement, and mindfulness practice can reduce the need for heavy drug exposure. Even small steps like volunteering, gardening, or joining a group activity can lift mood without straining the brain. Consider the case of Linda, a 70-year-old widow from Florida. After her husband passed away, she was prescribed Zoloft to help cope with grief. At first, it helped her feel lighter, but she soon developed frequent headaches and occasional confusion. She never suspected her medication could be to blame. It was only after a minor fall and a hospital visit that doctors connected the dots between her SSRI and her symptoms. Her dose was adjusted. Her therapy sessions increased, and she began joining a walking group. Her mood lifted while her risk dropped. The message is clear. SSRIs can save lives, but they can also carry silent risks for seniors. The key is to balance benefit with caution, to ask doctors whether the prescription is still the safest choice today, and to monitor for warning signs, because protecting mental health should never come at the cost of brain health. And if antidepressants carry hidden bleeding risks, the next group of medications may surprise you even more. They are not meant for mood, but for sleep. And while they promise rest, they can quietly double the risk of stroke. Part 4. Sleep medications and the nighttime stroke trap. For many seniors, the hardest part of the day is not morning stiffness or afternoon fatigue, but the long, lonely night when sleep refuses to come. Tossing and turning, staring at the ceiling, counting the hours until dawn. These moments can make even the strongest person feel weak. That is why millions of older adults turn to sleep medications. Pills like Xanax, Valium, or Ativan, often prescribed for anxiety or insomnia. At first, they feel like a miracle. Within minutes, the body relaxes. The mind slows, and rest finally arrives. But what most seniors do not realize is that these very medications, known as benzodiazepines, may quietly double their risk of stroke. Why does this happen? Benzodiazepines work by slowing down brain activity and calming the nervous system. While this provides short-term relief, it also lowers blood pressure and reduces circulation. For seniors whose arteries are already stiff and fragile, this drop in blood flow can set the stage for clot formation and reduced oxygen delivery to the brain. At night, when the body is at its lowest point of readiness, this becomes especially dangerous. Instead of restoring the body, sleep under the influence of these drugs may increase the risk of both ischemic stroke from clots and hemorrhagic stroke from vessel weakness. Scientific research has confirmed this danger. A study in the British Medical Journal found that older adults who regularly used benzodiazepines had about a 50% higher risk of ischemic stroke. Research in the journal Stroke reported that even short-term use could trigger blood vessel constriction and irregular clotting patterns. What makes it more alarming is how common these drugs are. More than 1 in 10 seniors in the United States take benzodiazepines, many for years at a time. Despite medical guidelines recommending only brief use, the problems do not stop with stroke. Benzodiazepines cause dizziness, daytime drowsiness, and impaired coordination, which lead to falls, head injuries, and hospitalizations. These complications add even more stress to an already fragile circulatory system. Cognitive decline is another silent effect. Seniors on long-term benzodiazepines often report memory loss and confusion, symptoms that mimic dementia and rob them of independence. Dependence is another risk. Once the body adapts to these drugs, it becomes very difficult to stop, and attempts to quit suddenly can trigger dangerous withdrawal symptoms. There are safer ways to manage insomnia and nighttime anxiety. Non-drug approaches such as evening relaxation routines, meditation, and gentle stretching can help reset the natural sleep rhythm. Natural supplements like melatonin may support sleep without the vascular side effects of benzodiazepines. Cognitive behavioral therapy for insomnia has been shown to be highly effective in seniors, helping them change habits and thought patterns that interfere with rest. Even simple steps like reducing caffeine, dimming lights in the evening, and keeping a consistent bedtime can restore balance over time. Consider George, a 74-year-old retired teacher from Michigan. He began taking Xanax for anxiety and Valium for sleep after his wife passed away. At first, he felt grateful for the relief. But within months, he noticed tremors, confusion, and frequent dizzy spells. After a minor stroke, he finally understood that the very pills giving him sleep were quietly undermining his brain. With guidance from his doctor, he tapered off the benzodiazepines, started a nightly relaxation routine, and replaced the medication with melatonin. His sleep improved gradually, and his risk decreased. The lesson is clear. Sleep is essential, but it should heal, not harm. If you rely on benzodiazepines, do not stop suddenly. But do not stay silent either. Talk with your doctor about safer alternatives and gradual changes, because the calm you seek at night should not come at the cost of a devastating stroke. And if sleep medications carry hidden risks, wait until you hear about the next group of drugs. They are not prescriptions at all, but over-the-counter antihistamines that many seniors use for allergies or even as sleep aids. These familiar pills may feel harmless, yet they too can quietly raise the risk of stroke. Part 5. Antihistamines and the over-the-counter danger. When most seniors think of medication risks, they imagine the orange bottles behind the pharmacy counter. Yet some of the most dangerous drugs for older adults sit right on the shelf at your local store. Available without a prescription, I am talking about old generation antihistamines like diphenhydramine, the active ingredient in Benadryl, which many people use not only for allergies, but also as a nighttime sleep aid. Because these pills are sold freely, seniors often assume they are harmless. But in reality, they can quietly increase the risk of stroke. Antihistamines work by blocking histamine, a natural chemical in the body involved in allergic reactions. That is why they calm itchy eyes, sneezing, or hives. The problem is that these drugs also have strong anticholinergic effects, meaning they dry out the body, slow fluid balance, and make the blood more concentrated. For seniors, this dehydration effect can thicken blood, reduce circulation, and increase the chance of clot formation. They can also cause irregular heartbeats and raise blood pressure at night when hydration levels are already low. This combination quietly primes the body for stroke during the very hours when seniors believe they are resting safely. Research confirms the danger. A study published in JAMA Internal Medicine found that long-term use of strong anticholinergic drugs, including older antihistamines, was linked to a 54% higher risk of stroke and dementia in older adults. Another report showed that regular diphenhydramine use in seniors increased nighttime blood pressure spikes, one of the most common triggers for strokes during sleep. Despite these findings, Benadryl remains one of the most commonly purchased over-the-counter medications in the United States, especially among adults over 60. The hidden dangers go beyond stroke. Antihistamines can cause confusion and memory problems, leading seniors to believe they are developing dementia, when in fact, the medication is to blame. They cause drowsiness and slow reflexes, raising the risk of falls and injuries. Men with prostate problems may experience urinary retention, which adds stress to the body at night. These side effects chip away at independence and quality of life while quietly increasing cardiovascular risk. There are safer alternatives. For allergy relief, second-generation antihistamines like loratadine or cetirizine are much safer and non-sedating. For sleep, natural options such as melatonin or valerian root may provide relief without the cardiovascular burden. Even simple sleep hygiene habits, like keeping the bedroom cool, avoiding caffeine late in the day, and dimming lights before bedtime, can restore rest more safely than a nightly Benadryl tablet. Seniors should always discuss with their doctor before switching. But awareness is the first step. Consider Carol, a 69-year-old retired nurse from Arizona. She wanted to avoid prescription sleeping pills, so she reached for Benadryl each night, believing it was a safe habit. Within a year, she began experiencing memory lapses and confusion. One night, she awoke dizzy and disoriented, later discovered to be a transient ischemic attack. Her doctors traced the problem back to nightly diphenhydramine. Once she stopped and adopted safer alternatives, her clarity and stability gradually returned. The lesson is sobering. Just because a pill is available without a prescription does not mean it is safe for long-term use, especially after 60. For seniors, what seems like a harmless over-the-counter medication can quietly raise the risk of stroke and erode independence. If you or someone you love uses old antihistamines regularly, it is time to rethink that habit. Awareness and small changes may prevent a tragedy. And if over-the-counter pills can hide such risks, wait until you hear about the next group of medications. Diabetes drugs that millions of seniors take daily without realizing the hidden danger they carry for the brain. Part 6. Diabetes medications and the blood sugar trap. Diabetes is one of the most common conditions in seniors, and controlling blood sugar is a lifelong battle. For millions of older adults, the battle is fought with pills taken every morning, often without a second thought. Among these, sulfonylureas, such as glyburide, glipizide, and glimepiride, have been prescribed for decades to keep glucose levels down. They work by stimulating the pancreas to release more insulin. At first, this sounds like exactly what a person with diabetes needs. But hidden within this action is a risk that can quietly set the stage for a stroke. Here's the problem. Sulfonylureas do not stop working when your blood sugar hits normal. They keep pushing insulin out, and that can cause blood sugar to crash too low, a condition called hypoglycemia. For a younger person, this might mean feeling shaky or dizzy. For an older adult, it can mean confusion, fainting, or even slipping into unconsciousness during the night. The body responds to dangerously low blood sugar by releasing stress hormones like adrenaline, which drive blood pressure and heart rate up. In seniors with already fragile arteries, this roller coaster effect can create clots, trigger arrhythmias, and dramatically raise the chance of stroke. Scientific studies confirm this link. A trial published in Diabetes Care found that older adults using sulfonylureas had more than double the risk of hospitalization for hypoglycemia, and many of those events were followed by strokes or heart attacks. Another large study showed that glyburide users in particular faced higher cardiovascular mortality compared to patients on newer classes of diabetes medications. The American Diabetes Association has even issued caution about sulfonylureas for seniors, highlighting their connection with sudden strokes and heart events. The risks extend beyond blood sugar crashes. These drugs can lead to weight gain, further straining the heart and worsening insulin resistance. Episodes of dizziness or fainting from hypoglycemia often result in falls, head injuries, and hospital stays. each of which compounds stroke risk. Seniors taking multiple medications are especially vulnerable because interactions can intensify the drop in blood sugar. There are safer alternatives. Newer drugs such as DPP-4 inhibitors like sitagliptin or GLP-1 receptor agonists like semaglutide offer effective blood sugar control with a lower risk of hypoglycemia. Lifestyle interventions also make a powerful difference. Balanced evening meals with protein and fiber help stabilize glucose overnight. Seniors on sulfonylureas should never skip dinner or bedtime snacks. And they should monitor blood sugar more closely, especially at night. For some, switching to newer medications under medical supervision can dramatically reduce stroke risk while still controlling diabetes. Think of Robert, a 73-year-old grandfather from Illinois. He had taken glyburide for more than 10 years, believing it was keeping him safe. But one night, he collapsed after a severe hypoglycemic episode, and doctors later confirmed he had suffered a stroke. His family was shocked to learn that the very pill meant to manage his diabetes had played a role in triggering the crisis. With newer medications and careful monitoring, Robert regained stability, but the warning remains. The key lesson is clear. Diabetes must be managed, but not at the cost of doubling stroke risk. If you or someone you love is on an older sulfonylurea, do not stop suddenly, but do start a conversation with your doctor. Ask if there is a safer way to control blood sugar without putting your brain in danger. Awareness and small adjustments can mean the difference between safe management and a sudden medical emergency. And if diabetes drugs can carry such hidden risks, imagine what can happen when thyroid medications prescribed for energy and metabolism tip the body into overdrive. That is the next danger we need to uncover. Part 7. Thyroid and hormone medications when energy turns into danger. For millions of older adults, fatigue, sluggishness, and weight gain are familiar struggles. Many women and men in their 60s or 70s are diagnosed with an underactive thyroid, known as hypothyroidism. The standard treatment is a small daily pill of levothyroxine, a synthetic thyroid hormone. At first, the results seem miraculous. Energy improves, mood lifts, and the body feels more alive again. But here lies the hidden risk. When the dose of thyroid hormone is even slightly too high, which happens often in seniors as metabolism changes with age, the body can tip into a dangerous state. The heart beats too quickly, blood pressure rises, and an irregular rhythm called atrial fibrillation appears. Atrial fibrillation is not just a nuisance. It is one of the strongest predictors of stroke, raising the risk fivefold. Excess thyroid hormone also makes blood more likely to clot, putting fragile arteries in jeopardy. Scientific research supports these concerns. A Canadian study in Circulation found that seniors taking high doses of levothyroxine had a nearly 30% higher chance of developing atrial fibrillation. Another report in the American Journal of Medicine showed that overtreatment with thyroid hormone raised ischemic stroke risk by up to 40% in older adults. Despite this, levothyroxine remains one of the top 5 most prescribed medications in the United States, meaning millions may unknowingly be exposed to this risk. The problem is compounded by the fact that thyroid hormone needs careful monitoring. Yet many seniors go months or even years without proper blood tests. The therapeutic window is narrow. Too little hormone, and symptoms of fatigue and depression return. Too much, and the cardiovascular system is overstimulated. For seniors already coping with hypertension or vascular disease, the consequences can be catastrophic. Hormone therapy after menopause carries similar risks. Estrogen and progesterone replacement can ease hot flashes, mood swings, and bone aches. For many women, it feels like regaining control of their life. But large studies, including the Women's Health Initiative, revealed that post-menopausal women on hormone replacement therapy had significantly higher rates of blood clots and ischemic strokes. Estrogen influences clotting and vascular inflammation. And when introduced later in life, it can double the risk of a stroke. Other concerns include memory changes, increased risk of breast cancer, and higher chances of deep vein thrombosis. For seniors, every added risk matters, and hormone therapy is not always presented with the full picture. Safer options exist. For thyroid patients, regular blood tests every 6 to 12 months and careful dose adjustments can reduce risk. Sometimes a slightly lower dose still relieves symptoms without pushing the body into danger. Nutritional support with iodine, selenium, and zinc can also assist thyroid function naturally. For menopausal symptoms, non-hormonal medications, lifestyle changes, and bone health strategies can offer relief without elevating stroke risk. Consider Susan, a 71-year-old librarian who was prescribed levothyroxine. At first, she felt wonderful, but months later, she experienced palpitations and dizziness. Tests showed her dose was too high, and she had developed atrial fibrillation. With quick adjustments, her rhythm stabilized. But the scare taught her a powerful lesson. Medication meant to heal can also harm when not monitored closely. The message is clear. Hormones are powerful, and in seniors, they must be handled with caution. The goal is not to stop all treatment, but to ensure it is the right treatment at the right dose for the body today, not years ago. If you are taking thyroid pills or hormone therapy, do not ignore new symptoms like palpitations, dizziness, or unusual fatigue. Speak with your doctor, ask for updated tests, and confirm that your therapy is still appropriate, because protecting your energy should never come at the cost of risking your brain. And now that we have walked through all 7 categories of common medications linked to stroke, it is time to gather these lessons and close with the most important reminder of all. Doctor's final words. After decades of caring for seniors, I have seen one truth repeat itself again and again. Stroke does not appear out of nowhere. It builds quietly, often from the very habits and medications we trust the most. The 9 categories of drugs we have discussed today are not evil. They were designed to help, but when overlooked or misused, they can turn from healer to hidden threat. For older adults, every pill carries weight. Every dose shapes the future. The purpose of this message is not to frighten you into stopping your treatments. The real purpose is to empower you to ask better questions, to check your prescriptions, to make sure the medications you swallow each morning are protecting your brain and not placing it in danger. Remember this: stroke is preventable in many cases. By monitoring your medicines, by working closely with your doctor, by making small adjustments in lifestyle and diet, you can cut your risk dramatically. You still have the power to protect your independence, your memory, and your future. Your body has not forgotten how to heal. It only needs your support. So here is my call to you. Do not stay silent. Share this video with someone you love, because knowledge saves lives. Comment 1 if you learned something new today. Comment 0 if you want me to make this content even clearer. And above all, do not forget to like, subscribe, and stay connected. because every week we uncover more truths that can save years of your life. Your health is in your hands. Choose wisely. Act today. And let tomorrow find you stronger, clearer, and safer than yesterday.